All right, sir, you're on the record right now. Brooklyn Borough President Eric Adams, thank you so much for being with us here on ITV Gold. It's a pleasure to have you yet again with us, sir.
Yes, thank you so much for having me.
Of course, just starting off this show, I have so much to discuss with you. There's a lot that's happening in the nation. The number one question that everyone is asking living in New York City right now is, we are still moving ahead in reopening phases while the rest of the nation, about 31 states, are seeing a spike in COVID-19 cases, with 24 that have paused or rolled back on their reopening. What is your comment on what is happening and its impact on New York? And how important is it for us to sort of monitor this reopening in the city?
Well, I believe that you're seeing success in New York only because of New Yorkers. One thing about us, we have gone through tragedies before, and we always respond according to those tragedies. After September 11th, there was a real call of see something, say something, and New Yorkers did just that. We know how to follow directions. When you live in a close confined community in a city like New York City, where following instructions means a lot, this is something we're used to. And when the call was put out, face coverings, when it was put out, social distancing, and even shelter in place, many of us follow those orders, no matter how busy our city may have been at the time.
Yes, definitely. In terms of looking at these cases that are rising in other states, Brooklyn Borough President, are you concerned about New York and another surge of cases here due to the other states that are showing increase in cases?
Yes, we are, and I believe the governor and the mayor talks about those who are visiting, particularly those hot spots, those locations where you're seeing increases like Florida, California, Arizona. We have to be extremely conscious and ensure that when people come here, that they really shelter in place for a period of time, because we don't want to go back to where we were at the peak of this pandemic.
For sure. In terms of looking at Brooklyn now, I would like to discuss the borough with you. What has been some of the biggest measures you've had to take in order to combat the economic and the healthcare crisis? Because they're going hand in hand right now with COVID-19.
So true. It's alarming and concerning, to say the least, that it's predicted about 40% of our small businesses may not return. And at the same time, many of those small businesses in communities of our immigrant population and communities of color, the restaurants, the hair salons, some of the retail spaces, they are being the hardest hit. And it's unfortunate that when the first relief came on the federal level, it did not make its way down to some of our small and local businesses. The second and third wave of relief must focus on and be intentional about going after our small businesses. And that includes putting money in our local banking system, like our CDFIs, and making sure that the larger banks are actually giving our small businesses access to capital. But also, as we open, to make sure that people follow all the safety precautions based on the medical science and based on the rules that are handed down by the mayor and the governor of the state.
This brings me to a very important discussion on racial disparity and its impact on the Brooklyn borough itself. What communities have been impacted the most? And when you're looking at this disparity, how intense is that impact in Brooklyn?
It has been, Brooklyn has been hit extremely hard. New York City, as you know, was the epicenter of the coronavirus pandemic. Brooklyn was the center of that center. The first death took place in Brooklyn. Some of the largest number of cases happened in Brooklyn. And when you look at what happened at the beginning of the virus, we did not give the proper resources to Brooklyn. We failed to properly analyze our resources and make sure that there was an equitable distribution, and what I like to say, in real time. And I think because of the slow response on the state and city level, there were some serious problems that led to a high number of hospitalization and even in some cases a high number of deaths. It's unfortunate that the virus did not discriminate on who would actually catch the virus, but we had clear discriminatory processes on how we protect the people of the city. And I think it was a bad decision to divide the city into essential and non-essential employees, because we sent the message that some New Yorkers were more important than others, and that should have never happened.
Yes, and it shouldn't have. In order to look at the Black and brown communities, would you say that they are in the heart of this crisis and perhaps they need a little bit more attention?
Yes, for many reasons. These communities are really in the eye of the storm.
Yeah.
Because when you look at the number of people who are hospitalized, over 90% of them had pre-existing conditions. When we look at the number of people who died from COVID-19, over 90% of them also had pre-existing conditions. And when you look at even the nursing homes, the comorbidities inside nursing homes really led to a lot of the deaths that we witnessed in a nursing home. And when you talk about pre-existing conditions, you basically talking about those with respiratory issues, diabetes, heart disease, high blood pressure. Those numbers are high in impoverished areas that overwhelmingly Black and brown and immigrant. And so to not have an immediate response for those pockets and places that we knew would be hardest hit was really the wrong decision to make. And that's why you saw a disproportionate impact on Black and brown communities.
What kind of healthcare reform do we need in order to sort of, be there for these Black and brown communities and to really cater to their needs? Because a lot of them have been ignored in this crisis.
We have to really change the direction and conversation about healthcare, not only here in New York and Brooklyn, but across America. We have a healthcare system that depends on treating symptoms and not underlying causes. Many people know my reversal of type 2 diabetes. Yes. Based on changing my diet and my lifestyle. We have a clinic at Bellevue Hospital, one of the first of its kind in America, where we'll have lifestyle changes and showing how we could reverse diseases and get people off their medicine. We need to have that throughout our health and hospital system of how do we look at treating underlying causes, access to healthy food, showing people how modifications in their lifestyle can actually have an impact on their health care. Our healthcare system is not sustainable. We have 30 million Americans who are diabetic, 84 million who are pre-diabetic. We're spending 80 cents on a dollar on chronic diseases. Diabetes is the leading cause of blindness, leading cause of non-trauma limb amputation, one of the leading causes of kidney failure and heart disease. We have to do a better job. If we could just cut diabetes by 50%, we will have a major impact on our healthcare system, and we can save lives in the process. So now it's time to use this pandemic as a reason and an incentive for us to change how we're addressing medicine now in America and in New York.
And looking at the healthcare system, I'd have to ask you, what is the condition of the hospitals in Brooklyn right now in terms of the PPE supplies, ICU, enough beds and ventilators? Are we ready for a second wave if it happens?
Many of the experts and my hospital presidents that I communicate with every 2 weeks on a conference call shared with me that we're not out of the woods yet. October and November, coronavirus may come back with a vengeance, and we must be prepared for the reemergence. And right now it's imperative for our hospitals and our health system to put in place a large stockpiles of PPEs, hospital gowns, face masks, N95, surgical masks. We must also build out our infrastructure for food. We were caught flat-footed during the last outbreak when many of our seniors did not receive adequate meals. Many of them had to go without food services. And so it's imperative that we really shore up our hospitals by having a backlog of ventilators and other devices that are needed. And we should use this moment to really have our young and bright minds here in the city to look at ways of how do we create other and better breathing systems that won't be so invasive as the prior ventilators. Many people who were placed on ventilators died and did not recover. So there has to be another way of ensuring that we're not using something so evasive that it's taking the lives of people at the same time. So we need to use all that we've learned during this first wave and walk away with some best practices that can save lives and prevent the spread of coronavirus.
You have applauded testing in Brooklyn in terms of COVID-19 testing and antibody testings. Could you give us some insight into the work that has gone into providing enough testing? And do you need more testing in Brooklyn right now?
Testing is crucial, not only for the testing for the virus itself, but also the antibodies. Yes. The antibody testing, we just announced today about a substantial number of new antibody testings that's coming to Brooklyn. But the purpose of the testing is really to start showing us the pattern so we can fairly determine where resources need to go and start mapping out the areas of concerns. Seeing and identifying the antibody testing is a clear indicator that someone had the virus and may have recovered from it. One thing is for clear, this virus is a formidable opponent because one could be asymptomatic and spread the virus without even knowing it. So that's why it's crucial that we do contact tracing and we do antibody and regular testing for the virus so we can start mapping out using the GIS mapping system to determine exactly how the virus is spreading so that we can identify hotspots, give information, further testing, and allow people to play a role in preventing the spread of the virus.
That's very important. I really hope and for the best in testing, and it's so essential that we get a hold of this and there's some answers to it. I'd actually like to change this conversation a little bit right now at this point of the interview and discuss something that's very relevant and something that we're also discussing this entire month, which is a discussion on systemic racism, police brutality, and anti-Blackness. As somebody who has served 20 years in the NYPD and 20 years in public service, what has been your take on these demonstrations nationwide, and especially in New York City? How do you look at this, and what should we learn from this?
This is a very significant moment and is part of a relay race towards the victory line of changing policing in our country, not only here in New York. As a child, I was beaten by police, and so I understand the severity of having a police officer that represents the symbol of authority and power in America. For those across the entire globe should understand, inside our Constitution, it states you have the right to liberty and the right to life and the pursuit of happiness. And those are two important aspects of the American people. And the only entity in America that has the right to take away life and liberty is a law enforcement officer. They can take our life and they can take our liberty. And therefore, it is imperative that they are held to a standard that is extremely high. Historically, we have not done that. And that is why you see the countless number of marches. It's more than just Mr. Floyd's murder. It is the continuous abuse of authority in our criminal justice system. And so this reform is much needed. It was needed over 42 years ago when Arthur Miller, a prominent Black businessman, died from a chokehold. It was needed when Eric Gardner was killed through a chokehold, and it was needed when Mr. Floyd was also murdered through a form of a chokehold. And so we are at the right place now with the energy of young people who have received the baton for those who ran the mile before them, and now they must continue to take this across the finish line and say that Black Lives Matter.
Black Lives Matter has been painted on the streets of Brooklyn. You have showcased your support for that entire community. What did you have to say about these protesters and people that came out to demonstrate, especially in Brooklyn?
The protest is extremely important. It is the way of life to show your concern and stating that you will not become complacent to abuse. Now, I'm clear that protest does not mean throwing Molotov cocktails or burning down our cities and our neighborhoods. Protest is a peaceful way of displaying your concern, and it could include the disruption of service, such as doing sit-ins or die-ins, as some of the new protesters are calling it. All of that is appropriate because it's about making people feel uncomfortable, so that we cannot continue to allow communities to experience the discomfort of being in one of the richest countries on the globe. But we should be extremely clear that violence is not a way to get to an end or a means to get to an end. We should do it in a peaceful manner. I'm a student of Dr. King and Gandhi. I believe that you can show your higher order and your higher status by peacefully showing that you're not going to become that what you are protesting against.
I have a follow-up question for that. What do we tell our children of the community, the young Black and brown kids that are seeing everything unfold in front of them, that are seeing situations like Mr. Floyd's death go viral? What do you say to those young children that are watching it?
I tell them to stay the course. Every generation in this country and other countries had to answer the calling of their generation. Either you would betray that calling or you respond to it. My grandmother had to respond to the calling of the attack of Pearl Harbor, and her generation fought the wars to protect our soil. My mother's generation had to fight the wars of civil rights fight and the right to vote and the right to sit at a lunch counter and the ride a bus. They did not betray their generation. They carried the mantle. And this generation and my generation, we all had and will continue to have the calling of our generation. We must stay the course. And if you betray the calling of your generation, then you will only make it difficult for the generations to come. And so it's important that just this generation continues to stay the course and fight forward, run the mile, and be prepared to hand the baton over to the next generation. Because as long as we are human beings, there will be a fight to ensure that fairness and justice is pervasive in our countries.
Bibi Adams, you are running for mayor next year. This is such a high intensity time in the country. A lot is on the line. My question to you would be, what would you have done differently as the mayor of New York City if this has happened under you?
Well, I have not formally announced the race for mayor. I'm really focused on my role as the borough president, but just as an assessment of what we could have done on the city or the state level, the most important sentence is to properly manage your assets and have a fair distribution of resources in real time. We did manage our assets. It took some time before we were able to get the personal protection equipment. We did not distribute it in a fair manner across the entire city and state to all of our hospital, healthcare facilities, and nursing homes. And we didn't do anything in real time. In far too many cases, we responded too late to some serious crises. And I think due to that, we lost the lives of many innocent people. We could have done a better job of just really managing our assets and ensure the equitable distribution in real time. We live in a real-time universe. Everything is instant. No one waits a week or a month or even a day to find out the current news. Everything we do must be in real time, and it's time to move our city and state and country to a real-time government. And this way we can really catch the problems before they become crises.
I truly appreciate you for your time here. I just have one last question left for you. My question to you has to be, what is your vision for the next 4 weeks? What is your focus as the Brooklyn Borough President? What needs the most attention from you at this hour?
Well, we have to be ready for our educational system. September is going to be here before we know it. We must have a real plan of opening our schools, that our children are safe and are able to receive a quality education. And that is ensuring that every child has access to high-speed broadband and Wi-Fi. And then we have to build out a real infrastructure of healthy food as we feed the countless number of New Yorkers who are in need of food. And lastly, the economics of the city. We're dealing with a substantial $9 billion budget deficit. It's imperative that we get our economy up and running, access to capital, receiving the financial assistance from our federal and state government, and focusing on how do we get our local and small businesses back operating so they can continue to hire and our city can move forward and improve on our tax base so that our city can function.
You know, just on education, just one question I had. Today, ICE announced a big ruling towards international students, and they're saying that if they don't go back into an in-person school, they may not be allowed to live in the country. Is there any comment you have on ICE's announcement?
A bad decision, wrong decision, and we can't allow politics to get in the way of education. Clearly, this is a political stunt. I believe it's imperative the young men and women who study at our academic facilities play a vital role in the actual functionality of this country. We are who we are because of our diversity and all of the ideas that come here. People come here because they want to be part of the American experience. And while they're here in school or while they're here in being employed, they contribute to this country, and we need to continue to allow them to continue their studies,
Definitely.
either online, remotely, or inside a classroom.
Yes, for sure. Well, thank you so much for your time here on ITV Gold. Brooklyn Borough President Eric Adams, I would love for you to give one last message to all the South Asian Americans watching you on the network.
Our South Asian community is such an important community, and I'm happy the level of friendship and support that I receive from the South Asian community, the contribution in business, the contribution in culture. We are a better city because of the contribution that comes from the South Asian community. Let's continue to celebrate our diversity, and I believe no community does a better job and personifies the American experience better than the South Asian community does every day. Thank you very much.